Urologist reveals common medication that puts elderly bladders at risk and could cause cancer. Have you ever started a new medication and noticed your body began behaving strangely? Maybe you started waking up multiple times during the night with an urgent need to urinate, or perhaps you felt a burning sensation that wasn't there before. What if I told you that one of the most commonly prescribed medications for diabetes, something millions of elderly people take every single day, could be silently damaging their bladder and dramatically increasing their risk of developing bladder cancer? This isn't fear-mongering. This is medical reality backed by over a decade of scientific research. Yet most patients have never been told about these risks by their doctors. The pharmaceutical industry generates billions of dollars from this medication annually. Before we dive into this critical information that could save your life, I need you to do something important right now. Click the subscribe button and activate the bell notification. By doing this, you'll become part of our health community, where we share real solutions and critical information that many doctors don't have time to explain. Each video on this channel is designed to empower you with knowledge that helps you make better decisions about your health and well-being. Subscribe now, because what I'm about to reveal could literally be the difference between maintaining a healthy bladder and facing a devastating cancer diagnosis. The medication I'm talking about is called Pioglitazone, one of the most frequently prescribed drugs for managing type 2 diabetes in people over 60. According to the Centers for Disease Control and Prevention, more than 37 million Americans are currently living with diabetes, and approximately 8.5 million are over 65. Of those elderly diabetics, millions are prescribed Pioglitazone because it helps their bodies use insulin more effectively. Your doctor prescribed it, you trust their judgment, and you take it faithfully every single day. But here's what most doctors don't explain. Multiple comprehensive research studies conducted over the past 15 years, including a landmark investigation published in the British Medical Journal in 2012 and confirmed by studies through 2024, have found something deeply concerning. Patients who take Pioglitazone for more than 12 consecutive months show a 40% increased risk of developing bladder cancer compared to diabetic patients taking other medications. Margaret was a 68-year-old retired elementary school teacher from Columbus, Ohio. She had always been health conscious, maintaining a balanced diet and walking regularly. When diagnosed with type 2 diabetes in 2015, she trusted her family doctor completely and began taking Pioglitazone as prescribed. 3 years later, in early 2018, Margaret began noticing blood in her urine. At first, she dismissed it as a urinary tract infection. After 2 rounds of antibiotics with no improvement, her doctor finally ordered a cystoscopy, a procedure where a small camera examines the bladder interior. The results were devastating. Margaret had stage 2 bladder cancer. She had no family history of bladder cancer, had never smoked, and had no other obvious risk factors. The only significant element in her medical history was her 3 years of consistent Pioglitazone use. When her oncologist reviewed her records, he immediately flagged the diabetes medication as the most likely culprit. So how exactly does Pioglitazone cause this damage? Pioglitazone belongs to a class of medications called thiazolidinediones, and it works by activating specific receptors that make cells more sensitive to insulin. While this mechanism helps manage blood sugar, it has dangerous consequences for bladder cells. Research from the University of California, San Francisco, discovered that when bladder tissue is exposed to Pioglitazone over extended periods, the cells lining the bladder, called urothelial cells, begin to undergo abnormal changes. These cells form your bladder's first line of defense against toxins and waste products passing through your urine. When these protective cells start behaving abnormally, your bladder becomes vulnerable. Pioglitazone also interferes with your body's natural DNA repair mechanisms. Every day, every cell experiences tiny amounts of DNA damage from normal metabolic processes. Your body has sophisticated systems to identify and repair this damage before it leads to cancer. However, Pioglitazone suppresses these DNA repair systems, specifically in bladder tissue, allowing damaged cells that should be eliminated to survive and multiply. Additionally, the medication causes chronic low-grade inflammation throughout the bladder wall. Decades of cancer research have proven that chronic inflammation is one of the most significant drivers of cancer development. When you combine suppressed DNA repair, abnormal cell behavior, and persistent inflammation all happening simultaneously, you create what cancer specialists call a perfect storm for tumor development. The risk of developing bladder cancer from pioglitazone isn't distributed evenly among all patients. Certain factors dramatically multiply your personal risk. If you're over 65, your risk is significantly higher because your body's natural detoxification and DNA repair capabilities decline with age. If you've been taking pioglitazone for more than 24 months, research shows your risk increases exponentially. If you're a current smoker or even quit decades ago, the combination multiplies your bladder cancer risk by a factor of 6. If you have a history of recurrent urinary tract infections, your bladder tissue is already compromised. And if you're a woman, your risk is actually higher than men taking the exact same dose, likely due to anatomical differences in the female bladder and urinary tract, as well as hormonal factors. Robert was a 71-year-old, retired construction worker from Tampa, who had been taking pioglitazone for 5 years. He started experiencing a weak urine stream, difficulty emptying his bladder, and a feeling that he always needed to urinate. His doctor attributed these symptoms to an enlarged prostate, extremely common in men his age. 6 months later, when his symptoms worsened and his urine became cloudy with a pinkish tinge, a CT scan revealed a mass inside his bladder. Robert required radical surgery to remove his entire bladder, followed by months of chemotherapy. Surgeons had to reconstruct a new way for his body to store and eliminate urine using a section of his intestine. His life was permanently altered by a medication he trusted. Let's pause here because I want to ask you something deeply personal, and I promise this isn't invasive, but rather potentially life-saving. Have you, or has someone you love been taking pioglitazone? Do you know anyone over 65 managing diabetes who might be on this medication? Have you noticed any changes in urination patterns, any traces of blood in urine, any unexplained bladder discomfort? This feeling of uncertainty, of not knowing whether symptoms are normal or dangerous, can be absolutely overwhelming. So many people suffer in silence, afraid to speak up, afraid of being dismissed. If you identified with anything I've said, I want to invite you to share your experience in the comments below. It can be as simple as, "I've been taking this medication for X years and never knew about these risks," or, "My parent has been on pioglitazone and recently started having bladder problems." Your comment might seem insignificant to you, but for someone else reading these comments, someone experiencing the same symptoms or concerns in silence, your words could be exactly the validation and wake-up call that person desperately needs to schedule an appointment and potentially prevent a cancer diagnosis. You are absolutely not alone, and your willingness to share can help create a network of awareness that saves lives. Please comment right now while this information is fresh, and let's work together to shine light on a risk that far too many people face without knowing it. So what should you do if you're currently taking pioglitazone? First and most critically, do not abruptly stop taking your diabetes medication without consulting your healthcare provider. Uncontrolled diabetes is extremely dangerous and can lead to serious complications, including kidney failure, blindness, severe nerve damage, heart attacks, and strokes. Your diabetes absolutely must continue to be managed effectively. However, you need to schedule an appointment with your doctor as soon as possible to have an informed conversation about alternative medications. There are several excellent classes of diabetes drugs that have been proven effective and do not carry this bladder cancer risk. Metformin is typically considered the gold standard first-line medication for type 2 diabetes and has decades of safety data with minimal serious side effects. GLP-1 receptor agonists, medications like semaglutide, which you might know as Ozempic or Wegovy, and liraglutide not only help control blood sugar, but also promote weight loss and have demonstrated cardiovascular benefits, all without bladder cancer association. SGLT2 inhibitors, such as empagliflozin and dapagliflozin, work by helping your kidneys eliminate excess glucose through urine and have shown impressive protective effects for heart and kidneys. DPP-4 inhibitors like sitagliptin offer another alternative with no connection to bladder cancer risk. When you meet with your doctor, be direct and informed. Tell them clearly that you're aware of the published research linking pioglitazone to increased bladder cancer risk, and that you want to discuss transitioning to a safer alternative. A competent, caring physician will respect your concerns and work with you to find a medication regimen that manages your diabetes effectively while minimizing cancer risk. If your doctor dismisses your concerns or makes you feel foolish for asking questions, strongly consider seeking a second opinion from another endocrinologist or primary care physician who will take your health seriously. If you've been taking pioglitazone for any significant length of time, especially more than 12 months, you need to be proactive about bladder cancer screening. Schedule an appointment specifically to discuss bladder health monitoring. Ask for a comprehensive urinalysis to check for microscopic blood in your urine, an early warning sign of bladder problems. Consider requesting a referral to a urologist for a more thorough bladder evaluation, particularly if you've been experiencing any urinary symptoms. Be extremely vigilant about monitoring for warning signs of bladder cancer. These include visible blood in your urine, which might appear bright red, pink, or cola-colored. Increased frequency of urination, especially waking up multiple times at night when that wasn't your normal pattern. An urgent, sudden need to urinate even when your bladder isn't full. Pain, burning, or discomfort during urination that doesn't improve with antibiotics. And unexplained pain in your lower back, sides, or pelvis. These symptoms can be caused by many benign conditions like urinary tract infections or kidney stones. However, in someone with a documented history of pioglitazone use, these symptoms warrant immediate, thorough medical evaluation. You cannot afford to ignore them. Early detection of bladder cancer makes an absolutely dramatic difference. When caught at stage 1, while still confined to the inner bladder lining, the 5-year survival rate exceeds 95%, meaning the vast majority of people are completely cured. However, if bladder cancer progresses to stage 4, where it has spread to other parts of the body, the 5-year survival rate plummets to less than 15%. Catching it early is literally the difference between a highly curable disease and a potentially fatal one. You might wonder why pioglitazone is still available if these cancer risks are so well documented. Agencies like the Food and Drug Administration operate on a risk-benefit analysis framework. They've determined that for certain specific patients, particularly those who have tried multiple other diabetes medications without success, the benefits of achieving good blood sugar control with pioglitazone might outweigh the potential bladder cancer risk. However, what frustrates many physicians and patient advocates is that this calculation often fails to adequately account for the reality that there are now numerous alternative medications available that can provide similar or superior benefits without carrying this specific cancer risk. There's also a significant time lag in how medical practice changes. Even when serious risks are clearly identified and published in respected medical journals, it can take years or decades for that information to fully penetrate everyday clinical practice. Many doctors tend to continue prescribing medications they're familiar with unless there's a dramatic safety alert or the drug is completely pulled from the market. When serious side effects emerge for a widely used medication, pharmaceutical companies typically add warnings to the medication's label and prescribing information, but crucially, they don't proactively reach out to inform existing patients who are already taking the drug, and they don't actively encourage doctors to systematically review their current patients and switch them to safer alternatives. This is precisely what happened with pioglitazone. In 2011, the FDA added a black box warning about bladder cancer risk to pioglitazone's official label. However, this didn't result in widespread patient notification or trigger systematic reviews of existing prescriptions. Patients continued taking their medication every single day, completely unaware that each passing day was incrementally increasing their cumulative cancer risk. What makes this even more troubling is that the elevated bladder cancer risk associated with pioglitazone doesn't simply disappear the day you stop taking the medication. Comprehensive studies that tracked patients who discontinued pioglitazone found that their increased bladder cancer risk persisted for at least 5 full years after they stopped taking the drug. This strongly suggests that the cellular damage and genetic mutations caused by prolonged pioglitazone exposure have lasting, potentially permanent effects that don't automatically reverse once you quit taking it. This is precisely why early awareness, prevention, and proactive decision-making are so absolutely crucial. Every single additional month that you continue taking pioglitazone potentially adds to your cumulative lifetime cancer risk, and that risk accumulation doesn't reset to zero the moment you stop. If you're currently taking pioglitazone, every single day that you delay having a serious conversation with your doctor about switching to safer alternatives is another day of unnecessary and avoidable risk exposure. Your diabetes absolutely still needs to be managed carefully and effectively, but that management can be accomplished using medications that don't carry this specific and significant cancer risk. I want to end this video with a message of genuine empowerment and hope. Knowledge truly is power, and you now possess knowledge that many people, including unfortunately many healthcare providers, don't fully understand or appreciate. You are absolutely not helpless or powerless in this situation. You have fundamental rights as a patient: the right to question your medications and their potential risks, the right to ask informed questions about alternative treatment options, the right to seek second or third medical opinions, and the right to make fully informed decisions about your own healthcare and body. Modern healthcare at its best should function as a true partnership between informed, engaged patients and knowledgeable, caring healthcare providers, all working together toward achieving optimal health outcomes. If you're currently taking pioglitazone, I'm urging you to schedule an appointment with your doctor this week, not next month when it might be more convenient, but this week to have a detailed discussion about medication alternatives. If you're not personally taking pioglitazone, but you know someone you care about who is, perhaps a parent, grandparent, spouse, or close friend, please share this video and this vital information with them today. Early action, informed decision-making, and proactive health management are your most powerful defenses against preventable diseases like medication-induced bladder cancer. If this video has opened your eyes to serious health risks you weren't previously aware of, just imagine what other critical, potentially life-saving health information you might be missing. I want you to subscribe to this channel right now and join the thousands of people who have already transformed their entire approach to health and wellness through knowledge, awareness, and empowerment. On this channel, you'll find much more than just dry medical information and statistics. You'll discover practical tools and strategies to effectively advocate for yourself in medical settings, to know when and how to question healthcare recommendations, and to make decisions that genuinely prioritize your long-term health and well-being. Click that subscribe button right now, activate your notifications so you never miss an important video, and together, let's build a vibrant, supportive community where no one has to suffer preventable harm simply because they didn't have access to information that could have protected them and saved their life. Your health is without question your most valuable and irreplaceable asset, and protecting it effectively starts with being well-informed and willing to ask tough questions. Take that crucial step right this moment, hit that subscribe button, and make a genuine commitment to being an active, informed, engaged participant in your own healthcare journey. Thank you so much for watching this video, for taking your health seriously, and for being willing to learn. Stay informed, stay proactive, stay healthy, and please never stop asking important questions about what you're putting into your body and why.